The color, the fun, and the allure of the lakeside town of Homa Bay have ushered more than 11,000 delegates for the 10th Devolution Conference. Speech after speech, leaders laid bare the gains in healthcare thanks to devolution.
Many of the counties have moved miles from where they were before. We now have a UHP program. We have equipment in our hospitals. We also have facilities that we have built and upgraded.
You saw that we were celebrating 96 days, straight days of no single mother lost in Homa Bay due to maternal mortality. Every Tuesday morning, we have a meeting where any mother lost is discussed. It has to be explained why that mother was lost, how she was lost, and doctors and the healthcare workers review among themselves.
However, the challenges facing Kenya's healthcare system cannot be overlooked. This conference arrives at a pivotal moment as the country navigates major healthcare reforms that directly affect millions of Kenyans seeking medical care. The transition from the National Hospital Insurance Fund, NHIF, to the Social Health Authority, SHA, has brought significant disruptions, leaving many patients struggling to access services they previously relied on.
And no facility, no dispensary, no health center or sub-county hospital should charge citizens who go to seek treatment because the government of Kenya will refund for the treatment, for the medicine given to citizens at that level.
The withdrawal of international donors has created a funding gap, leaving hospitals understaffed and undersupplied just when Kenyans need healthcare most.
My greatest challenge for me is human resource. For example, we've been looking to hire oncologists and we are not getting the numbers that we have. We also are looking for experts who manage ICUs and HDUs, and many of them who are in urban areas may not want to move to rural counties.
The Ministry of Health estimates it needs about 500 billion Kenya shillings to finance healthcare in the current financial year. However, only 204 billion Kenya shillings was allocated. Combined with funding cuts from key donors such as USAID and other Western partners, Kenya now faces a dangerous financing gap.
35% of our healthcare is funded by donors. 35%. Do you know how much that is? 82 billion Kenya shillings. 35%. I'm the accounting officer, so I know my figures very well. You can ask me my budget offhand, I'll tell it to you. Okay? 35% donors. 82 billion. DG aliwaambia watu wanatoroka. Si ndio? US government wameenda. Gavi wanaenda. Global Fund 40% down. 6.5 billion shillings down. Just announced 2 weeks ago. Si ndio? Tunaelewana vizuri? So now we must cover the cost of 35%.
But it's not all doom and gloom. It's also an opportunity for us to be able to design our own interventions for our own people. Therefore, what we are doing as a government, of course, is to be able to domestically resource mobilize for our interventions.
We do not want to make health a privilege. We want to make it a right for all citizens.
But in most counties, it still feels like a privilege you have to pay, plead, or pray for. As the devolution conference gets underway, one question remains. With healthcare fully devolved, what's really standing in the way of delivery? Is it funding, politics, or lack of accountability? For the Frontera Media Group, I am Anne Mawathe.
If we can have